Imagine a new twist in the ongoing battle against COVID-19, a variant quietly gaining ground, leaving experts curious but cautiously optimistic. Enter Stratus, the colloquial name for the XFG variant, which is now spreading in the United States, particularly making waves in Mississippi. While it's not dominating headlines yet, its emergence raises important questions about symptoms, spread, and what this means for public health moving forward. But here's where it gets intriguing. Despite its growing presence, there's still much we don't know about Stratus. First identified in Southeast Asia back in January, XFG was virtually non-existent in the US until May. By late June, however, estimates from the Centers for Disease Control and Prevention, CDC, suggested that it accounted for up to 14% of cases nationwide. That's enough to make it the third most common strain circulating during the summer months. Yet, oddly, Mississippi presents a puzzling scenario. Data indicates a discrepancy between the number of people seeking treatment for COVID-19 and those actually carrying the virus. The World Health Organization, WHO, has placed XFG on its watch list, though global concern remains tempered. A late June report classified the additional public health risk posed by XFG as low. Even so, WHO emphasized that approved vaccines are expected to remain effective at preventing severe illness caused by this variant. Still, the situation invites debate. Should we be relieved or remain vigilant? And this is the part most people miss. Understanding how variants like XFG interact with our immune systems can feel abstract without context. So, what exactly is XFG? It's a hybrid offspring of two earlier variants, F.7 and LP.8.1.2, with LP.8.1.2 being the second most widespread strain in the U.S. According to Subhash Verma, a professor of microbiology and immunology at the University of Nevada, Reno, XFG's mutations might help it dodge some immune responses. However, its binding behavior suggests it's less likely to spread rampantly compared to other dominant strains. There is currently no clear evidence that XFG causes more severe disease or significantly different symptoms than earlier Omicron variants, Verma explained. Importantly, there are no immediate public health concerns associated with this variant. But does that mean we're entirely in the clear? XFG's rise has been steady but not meteoric. For instance, CDC data from the 2-week period ending June 21st shows that XFG represented 14% of U.S. cases, trailing behind NB.1.8, 43%, and LP.8, 31%. Globally, WHO reported a similar upward trend, with XFG jumping from just 7.4% of positive tests in early May to 22.7% by the end of the month. Could this growth signal a shift in the pandemic landscape? Now let's talk numbers. During the week ending August 2nd, 8.5% of Americans tested, out of 25,731 individuals, were positive for COVID-19, marking a 2% increase from the previous week. Emergency room visits related to the virus accounted for only 0.9% of cases, down slightly from the week before. Deaths remained low too, at 0.3%. Interestingly, western and southern states, including Washington, Oregon, Texas, and Louisiana, reported higher positivity rates during this time frame. Mississippi, meanwhile, tells a nuanced story. While emergency department visits linked to respiratory illnesses are climbing, they remain relatively low overall. Wastewater surveillance, however, paints a different picture, revealing elevated levels of viral shedding in the state. Since mid-June, Mississippi's Department of Health reports that visits to clinics and hospitals for COVID-related care have surpassed those for flu-related issues. What could this mean for local healthcare systems? When it comes to symptoms, XFG doesn't seem to deviate much from its predecessors. Hoarseness has been mentioned anecdotally, thanks to social media buzz and scattered news reports. Otherwise, the usual suspects apply: fever, cough, shortness of breath, sore throat, congestion, fatigue, muscle aches, headaches, nausea, and loss of taste or smell. If you experience trouble breathing, chest pain, confusion, or changes in skin color, the CDC advises seeking medical attention promptly. All things considered, XFG feels like a chapter in a constantly evolving book.
Does its emergence warrant alarm, or is it simply another reminder of the virus's persistence?
Should regions like Mississippi brace for impact, even if hospitalizations remain low? These are questions worth exploring, and ones we'd love your input on. Do you think we're overreacting, or is caution truly warranted? Share your thoughts below.